The two cases identified in South Carolina involve people who live in different parts of the state, do not appear to be connected, and have not traveled recently. Health officials are concerned about the South African variant because the COVID vaccines currently on the market may not be as effective against it. Top health officials are speaking in blunt terms about fears over this mutation of the virus.
Well, the one in South Africa, George, troubles me.
My biggest fear at this moment is that these variants are going to take hold and really take off across the United States. And if that happens, we're going to see a huge spike in cases, lots of infections, lots of deaths.
Officials say the strain has the dangerous combination of being more contagious than the original virus and less responsive to current vaccines. What's more, there are signs that some virus mutations may elude COVID tests, now being used widely, and may be less susceptible to antibody treatment. Scientists are acting quickly in case a booster shot becomes necessary for Americans.
We're going ahead already now and trying to stay a step or two ahead of things by making vaccines along the same type that we made for the ones we're giving now, but having it be directed specifically against the isolate that's in South Africa.
In addition to the South African isolate, the Centers for Disease Control and Prevention has reported at least 315 cases of the UK-discovered variant in the United States. Those reports have come from at least 28 states, and health officials believe it could become the dominant strain in the U.S. by March. Also, health officials in Minnesota reported finding the Brazilian variant of the virus earlier this week. Health officials also worry that if the virus changes enough, people might get COVID-19 a second time. This, as January is the deadliest month on record for the pandemic.
It's still a very serious situation. Now's the time to double down.
Doubling down means being sure to follow the standard safety precautions, wearing masks, social distancing, washing hands, and getting the vaccine as soon as you can, which may not be easy with demand far outweighing supply. The Biden administration working to get millions of more doses in the system and expand distribution centers across the country, beefing up the numbers of medical workers who can administer the shots. Still, with all that, there's a stark reality.
It will be months before everyone who wants a vaccine will be able to get one.
The White House is predicting some 90,000 Americans will die next month alone because of the virus. The CDC is recommending that Americans avoid travel. Eric Phillips, CBN News.